The official line in our hospitals are under strain. That's what we're hearing about. But now we're hearing about women in labor being turned away and overcapacity pediatric intensive care units. The details discussed by physicians are raising questions about whether the province is giving us the full story. CTV's Penny Daflos reports.
Concerns are growing about BC Women's and Children's Hospitals, which staff describe as being in disarray, with patients waiting on the floor of the emergency department at peak periods. In a meeting Monday, staff discussed a pediatric ICU staffed for only 12 patients, but seeing 13 or 14 at times. On one occasion, they had 16 critically ill children, 33% above capacity. Multiple patients are now treated by nursing teams when it used to be one-on-one care.
Pediatric ICU rates tend to change.
In mid-November, the health minister gave the impression things were under control. He didn't specify how many beds were actually staffed when he discussed capacity.
Essentially, we are at, as of today, as of yesterday, it was 67%. I think we reported that in our children's critical care beds today at 64%.
On Saturday, Children's Hospital briefly declared a code orange, usually reserved for mass casualty events, because they had too few staff to run the pediatric ICU. Just 2 weeks earlier, they'd opened an overflow emergency department for sick kids, which administrators downplayed.
It's a satellite clinic that we are staffing with our pediatricians.
At first, the hospital told CTV News there are 55 care spaces in the emergency department, but then acknowledged only 35 are actually staffed.
In terms of pediatric cases, yes, this is the busiest time I can remember.
With Surrey Memorial seeing triple the patients it was designed for.
The pediatric ER has been overrun for a while now. We're seeing approximately 250 kids per day.
But it's not just kids. Sources in the healthcare system have confirmed it's no longer unusual for Metro Vancouver hospitals to be on maternal diversion, meaning those in labor are sent away because they don't have the staff for a delivery. At the Monday meeting, doctors heard on many days patients at Women's Hospital are in active labor or in need of C-sections for hours before getting medical attention. At least one patient in Vancouver was told to go to Squamish Hospital to give birth.
Penny, concerning to hear about the range of problems in our hospitals. Are there any plans to ramp up pediatric intensive care capacity?
That's one of the big questions, mi-jung, and it was a topic discussed by the doctors at that meeting yesterday. They are trying to get the number of staffed beds from 12 to 18, given the need that we're seeing. I reached out to BC Children's Hospital for a timeline on when that might happen, as well as statistics on how many days they've had to turn away those in labor in the past 4 weeks. They have yet to respond, mi-jung.
Okay, thank you, Penny.